Hey, everybody, and welcome to Autism Awakening, the podcast that helps you help your child with autism. And we've got a special podcast today where we are going to be interviewing our guest, Lara O'Neil. Hey, Lara, how you doing? Good to see you guys. Good to see you. I'm glad that you joined in really quickly. This was great.
Yeah, I know. Yeah, you gotta move on the fly, right?
Yeah, always on the fly. I was just kind of giving a brief introduction. I want you to introduce yourself and talk about your new book that launches today, correct?
Yes. The ebook is available today, and then the paperback in a week and a half, something like on the 22nd. Yes, the ebook is available today. I'm so excited.
That is awesome. And again, my experience with Lara, she only lives probably a half hour down the road from myself. But she is a pediatric APRN. She was in the system and didn't like how the system was working, but instead of continuing to be part of the problem of the system, she decided to do something better for her patients, something better for her kids, something better for herself, which was to do what she feels is right to help our kids. And I think that is way above and beyond what most people do. So kudos to you for trying to make a difference.
Thank you very much. Yeah, I mean, like you said, what I feel is right. It was like, from the bottom of my heart and soul, it was like no choice. I had to, get out of the system that I knew was not what I wanted, how I wanted to serve, and most importantly, not helping patients. In some ways, of course, there's acute care, things like that, mainstream medicine is great for, but that's not really our main problem these days. Like, everybody knows about the conversations about the serious statistics around chronic disease and all the inflammatory issues going on, even with our kids. It's not just adults, it's our kids too.
Yeah. No, it's huge. And our audience obviously is talking to families who have kids with autism, and that's a huge group that has been failed by our mainstream system.
Oh, I know. I have a lot of families that were, just super frustrated by the system. So they found me, or and kudos to them for not, sort of taking no for an answer, or looking elsewhere when they know that the care that was given to their kid wasn't really in the best interest or wasn't going to be helpful. And they, these mamas and these parents are, amazing. I have so much respect for them because they're like, they're going to do it for their kid, and it's such a pleasure to be, a part of that. Yeah.
Sure. So tell people all about your journey, and about what your new book is about.
Yeah. So I have been, so it's been a process. I've been writing this book on and off for a few years. So it feels amazing to finally have it out to fruition. I was just talking to somebody earlier. It came to a complete halt for like 2 years when COVID hit. I wasn't writing at all because I all of a sudden was like, whoa, what what do I want to be writing about? What's my original intention? I was evolving as a writer. So but then I came back to it, and here it is. I'm excited to get it out. It really is kind of it's a three-parter almost, in all in one, where it's partly a memoir of my process, my evolution as a person, but really in the context of my career, starting back to when I was a child, and how my involvement with the medical system for myself, and watching what my mother went through has really shaped me as a provider. And then I got into the system, and after graduating and joining the practice that I was in, and just saw even more, like I was like wanted to do good, wanted to be a good provider, wanted to help kids, and was like all gung-ho. And then I got to it, and I'm like, oh, what is this? This is not what I thought it would be. But I was in it for a while, and I'm really, really grateful. I think I'm really grateful for that time, because I learned a lot about the system, from the inside out, what was good about it, what I wanted to change about it, and how I wanted to be as a provider. And so there's a lot of that memoir and stories, really vulnerable stories about myself, how I involved. And then it's also a, and a holistic guide in a way. I talk about, patient stories. I talk about what we need to change in the system, how I think that, healthcare can be improved. And then also like a call to action, that like we have spoke to before. There was really two audiences that I had in mind when I was writing. One was for the families, that we were just talking about, that I know and have been very frustrated with the care that they can access and have been kicked out of, pediatric offices for different choices, and have been looking and can't find anybody. And, I can't see everybody. You can't see everybody, and just knowing that there's a need for these families. So just wanted to reach out, at least in that way, get my word out that, hey, you can have this, and like keep looking for it. And this is what I want to do. And this is how I learn from you. And this is how I grow from, help being a part of your healthcare, your child and with your family. And like, keep looking for it, keep asking for it, keep demanding, keep pushing back, because market meets demand. And then also reaching out to those healthcare providers that I know are out there that are stuck in the system like I was, and they're just sort of doing it day by day, but like knowing in their heart that it's not right. And I just wanted to share my story around like, hey, you can do this too. It may not be easy, but you can go out on your own. You can start an integrative practice. You can join an integrative practice. You can function the way that you want to. You don't have to stay in the system just to make a paycheck. And it's just really important. Like, we need change. It's so obvious. And I am just thrilled to be sort of a part of this momentum that I feel like is going on right now. Is this sort of synchronicity of my book coming out right now. I didn't know, that everything was going to be happening in the Senate at this time, but I just feel like, okay, like this is it. Like, this is time. People need to speak out. People are, but more and more and more people need to speak out about the failures of the medical system and the unfair treatment to patients for the sake of profit. I mean, I'm going to say it. Like, my book does a lot of truth telling,
Good.
it's your truth or not. I mean, I had to express mine.
Yeah, no, that's awesome. Can you give everybody, some stories, because most people who I assume are listening are not in the system. They're the families that are going and not getting the care they need. So what are some of these stories behind the curtain that you experienced that made you want to change?
Yeah, that's a good question. There's a lot. But just something that's standing out right now as we're talking is, when I remember sort of a defining moment. I was speaking with my boss at the time when I was in a, mainstream pediatric office. This was, I don't know, 15, 20, it was a while ago now, but at the time, there was this new, guideline or advice or whatever for mainstream pediatrics to start screening 11-year-old children for lipid cholesterol. So my office went out and bought the screening test, so we can poke their finger and get their lipid level of every, that came into the office for a wellness. And I'm like, okay, like that's cool. But number one, what, okay, so can we take a look at like, why are we doing this? Like, instead of just testing everybody, like, why are we hello, why are we having to test the cholesterol levels of 11-year-old? It was in response to the obesity epidemic, but like, okay, so we're going to test, but okay, so all right, we skipped, the root problems, we skipped everything, but okay, here we are, we're going to test. So I spoke, with my boss about it, and I was like, okay, so what are we going to do if they have an elevated cholesterol? And he said, put them on a statin, I guess. 11-year-olds. And I mean, so much information has come out about statins since then, about, the danger and the risk, the other problems that it can cause. But I'm just like, oh, I just wanted to vomit. I'm like, really, that's your answer? Really, that's your answer? Like, I don't know why I was surprised, because that's how we were that's how, the care was. It was treating the
Mhm.
symptom instead of figuring out why.
Yeah.
And it's like, it's so obvious. Like, okay, so we have this beautiful opportunity to talk about nutrition and lifestyle, but guess what? That takes time. And we didn't have it. So you poke the finger, if their lipids are great, then you move on. If they're high, then you prescribe a drug. I'm like, I can't,
Yeah.
I'm not doing that. And that's just, I mean, there's a time and a place for medicine, but I can pretty firmly say an 11-year-old on a statin is not the answer. And I'm not at all like giving anybody a hard time who has done it or has, chosen to do it as an adult, but it was so representative of the problem. It was just like, oh my, I, like I said, I don't know why I was surprised, because it was in line. And he was a really, really smart, caring pediatrician. And still have so much respect for him. But he was in the system too, and that was his only answer. So it was like time and time again, I went to like going to doctors to ask for guidance if I was, perplexed or stunted, or just felt like I wanted to do more for the family of the child. And then their answer was over and over again, like, oh, just do this different drug, or oh,
Yeah. I mean,
yeah,
that's where the system's gone. And I know people who are younger kind of haven't seen that evolution like we've seen since, the 1980s and such, where, and again, I'm preaching to the choir, you know this better than I do, but it's numbers and numbers and numbers. And when you're seeing 30, 40 people a day, you don't have time to do anything but what the CDC or the American Academy of Pediatrics is telling you to do. Here's your guidelines. Go in, do it, cash your check, see you tomorrow.
exactly. I know. And it was all exactly like, and I was in it. I did not have time. It's so much easier to just prescribe a medication and for some whatever and then say goodbye. I, and I did it, and I hated that I did that. But I mean, I never prescribed a stat for 11-year-old, just to clear that up. But but it's true. It's the system, it's the algorithm. And I speak into my book of like, there are certain industries where algorithms can work, but we're human bodies and we are all so different. And that is hard. And that I dive deep with the family, with a patient around everything that comes into their health and their wellness journey. But it's important. You can't like, everybody from a 6-month-old to a 18-year-old to do the same thing. I mean, I was just talking to, I mean, this is just another little silly example, but I was just talking to a patient the other day around the flu shot. And I think you were speaking about that earlier. Um, it's the same dose that's given to a 6-month-old baby. That's it's the same dose. It used to be a little bit less, but that was changed. Like, I don't know, 5, 10, I can't remember now. It's the same dose, like probably easier, like just to have one manufacturer make one type and ship it out to all the pediatric offices and get rid of the mistakes, because everybody's going so fast. So they pick the wrong one. Okay, let's just make it all the same.
Right.
Yeah,
Crazy.
it is. It is. It's sad.
Yeah.
One thing if like, we're in the restaurant business and we served the wrong dish to somebody, but like we're not.
Yeah, but in the restaurant, it's like you said, it's everybody's doing for them. You go to a restaurant and you're like, hey, this is exactly what I want for me. But the system, like you said, just to make it easy and just to make it profitable, it's about consistency, it's about easeability. And if there's people who suffer, I feel like they get ignored. They're like, hey, we have a reasonable number of people that are going to suffer from what we're doing. But if that number is low enough, I can sleep at night.
Yeah,
That's
I know. And not, not to be all doom and gloomy about it, because I think, what you and I are here for is to really just like offer something that's different, and hope to continue to spread that ripple effect of reaching out to families and reaching out to providers. But this doesn't have to be this way. We do have a lot of barriers still with health insurance reimbursement, and seeing the value of integrative and holistic providers. But we have to start. We got to fight the fight. It's for our children. I mean, come on, what can be more important?
Nothing.
you
Nothing. At least for you and I, nothing. That's what we
Not,
do.
yeah, nothing. And I have three of them, and even when I was in the system, I was going to naturopathic doctors and different holistic providers for myself and my children, because I knew what would happen if I brought them. Like my boss was technically their pediatrician, and I went there a few times, and but like I knew what he would offer, like for situations, and I'm like, no.
Yeah. And look, if you've got strep, I would give my daughter an antibiotic, and that's great. It's
Absolutely.
short term, it's curative, and you move on. But
And
like you said,
seriousness of pandas, like it's absolutely, and that's what I love about what I do, is because I can do
right.
both. The time and a place for everything, and I talk about this a lot. It's just that conversation needs to be there and open and trustworthy. It's so sad how a lot of people don't trust their provider, or are scared to go to, they're going to get yelled at, or
Right.
and it's so important. And I feel like for kids, just that early stages of knowing, what it's like to go to the doctor, it's establish that trust into knowing what it should be about, and that it should be a partnership, with the family, and not.
Yeah.
Yeah.
So, well, let me ask you this, because I know a lot of our listeners and families come across it. What's going on in the mind of the provider when a mother or a father asks about something that's not, that's outside the box,
Yeah.
and get immediate resistance, get immediate, you're dumb, stop Googling, stop worrying, just don't, anything you said is wrong.
Yeah.
What's going on in their mind?
Yeah. Um, yeah, good question. I thought a lot about this. Um, I mean, yeah, once again, it's about time. It's really, if you open the door to any kind of nuanced conversation, and even if it challenges you as an individual and your own moral or personal values, it's a very hard conversation to have, to stay like present to what somebody is saying. And it's important, but it takes time, and it takes a release of your ego. And that's not how doctors are trained. They're trained to be, they're right, everybody else is wrong. I mean, listen, there's plenty of doctors that aren't like this, but I have just, there's almost this indoctrination. I feel like in medical school and traditional MD medical school, of the, of that they're right and everybody else is wrong. I don't know. It's weird. I mean, I didn't go to medical school on APRN, but I, with them, for, even back when I was a nurse and stuff in the hospital. And then, has an APRN as well. I worked very closely with them. I feel like they, they do care, they went into, healthcare because they wanted to provide healthcare, take care of people. And it's like I don't think anybody is like malicious about it. They just get caught up in this system. And also, they're tired. You're tired. You're hearing, people, every day after day, all the problems. It's tiring. And it's just easy to shut down complicated conversations because you don't have it you don't have it in you to give anymore. And I mean, that's really sad, right? And I talk about that in my book too, about like the importance of the healthcare provider in whatever avenue, even holistic, especially holistic medicine, to walk the talk around caring, the self-care, so that you're not going into work, going into, patient rooms depleted and exhausted and stressed. Like, I mean, of course you're like, life happens and you're gonna, but you have to have those tools, to, fill that cup back up again so that you can actually give and not just shut down. Because it's like, I've been there of like, I don't have the ability to do this right now, so whatever that is, it's not one way, self-care isn't like, there isn't one way of that. Going for a walk in the morning, whatever it is, there's all kinds of tools, meditation, and even just healthy living, nutrition, if you're going to have like McDonald's for lunch and then care for patients, you're going to get crabby, just silly things like that. It's like, so to wrap up your question, it's a system that they get sucked into. And that's the other thing I want to bring light and attention to that, try to have any sort of small ripple effect of change for the healthcare provider as well, because it's really important that we take care of ourselves so that we can take care of other people appropriately.
Yeah, no, and you bring up two things that I've noticed over the years, and I'm really glad you said it. And number one is that, being a healthcare provider in the system is high stress, and the burnout is there and it's real. And they're just people too. For some reason we put the doctors, we're trained and raised to put the doctors on this pedestal that they're somehow better, but they're just people. And if they're a parent and they're having problems at home and they're having problems with kids, or they've got a young baby and they're not sleeping, and we go and say, hey, I think what you're telling me is wrong.
Yeah.
If somebody came up to me and I had a rough day and I didn't sleep that night and they're like, you suck,
Yeah.
I'm going to become defensive. That's just human nature when we're stressed. And that's not to excuse their response, because that response isn't right for any of us, but you kind of see where it comes from. And like you said, people go, especially pediatrics. I mean, I don't know anybody who goes into pediatrics for the money of it. You go into pediatrics because you love kids. I mean, out of any of the specialties out there, you've got the heart and you've got the care to make a change and make a difference. But I remember one of my roommates from college, he went to med school and he's a urologist in Chicago now. But the difference in ego over 4 years of med school. I mean, he wasn't even a resident yet. He wasn't, practicing yet, but they train the ego, and they train the ego that you're right, everybody else is not. And it's the system, and that's how the system's failing us.
Even in nursing school, some teachers that encourages us to, about different cultures, especially around like, their healthcare practices. Because there was things like, like that we may in in an American hospital, it has like child abuse where like in a Mongolian spot or things like that. But I don't think they get, that in medical school so much. I mean, I think some programs, I think it's starting to change a little bit. There's some options of integrative medicine, holistic medicine in medical school. It's like, so you have to sort of seek it out. Like you have to sort of go like outside the box, but like it's, and say, oh, yeah, I do want to take this extra credit. I think it's starting to happen, but yeah, no, for the part, none of that is there. None of that is there around like evolving as a person and looking at your own stuff, so that you can come to the table without, without judgment and ego, and that's not talked about at all. In fact, it's the opposite.
bet. I bet. So let's move into kind of telling everybody out there how, obviously we know what has motivated you to change. How do you bring this now into your new practice? I mean, you've got an integrative pediatric practice, you're trying to do things how you see it better. What does that look like?
So yeah, well, I mean, lots of levels really. But you know, the most important is just, you know, taking a look. Well, I mean, you know, my mind's going a million places because there's so many things, but I guess I say number one is just being willing to taking a look at the bigger picture, root causes, the whole family system, the whole child, you know, to help with whatever the issue is at hand instead of just, you know, prescribing a medication or whatever it is. And then wellness visits are, you know, obviously a huge part of pediatrics. And I feel like, you know, unfortunately in most practices, it's just all about like give them their shot and get them like, you know, ask them a couple questions and get them out the door. But I see it's like, how's it an incredible opportunity to really get to know the child, get to know the family, get to know how they operate, what they want, what's important to them, the tools that they already have in their belt, you know, to take care of their child when they get sick or whatever it may be, and you know where they have questions and where they need support, and then dive deeper, excuse me, to those areas that are so important with the fundamentals of health, like nutrition and sleep and exercise, joy, and all, you know, all of those things. And so just a more well-rounded approach. And then I do believe, as you and I have spoken of before, about how powerful natural medicine can be in supporting both acute and more chronic disease, or you know, even just the, you know, the power of nutrition supplements for neurotypical kids. Is just such an important conversation to, you know, to be had. And that's just listening, really, like listening to the family. I mean, hello, it's not that hard. And that's when I learned the most. Like that's how I learned the most, even when I was in the convention, or, you know, especially when I was in the conventional setting, listening to them about their stories, what they've been through, the, you know, the eczema that flared all over their body after they were vaccinated, like, you know, back when I didn't even think about that, like, and just listening, and then getting curious, you know, asking questions, getting curious, then doing my own research, and I, you know, mind blown. Okay, there's and then adjusting, you know, to how you, you know, what can help other people and that family. It's just not that. I just don't feel like it's that hard. What is because what
it just takes time.
Yeah. Yeah, I'm just caring. Like you know, I want my families to like want to come to the office. I don't want them to cry the second they hit the parking lot. I mean, they're gonna sometimes, of course, you know. I mean, but it's just, I don't know. It's just, you know, just to feel like accepted and listened to, no matter what um, culture or religion or values or questions are, is just really important.
Yeah.
Yeah.
You know, and you use the word listening, and that means caring, and that means taking time and putting your own crap aside so you have the heart to care for somebody.
Right. Exactly. I mean, you have to have like, I mean, sure, have some boundaries, of course, you know, if that's that fine, you know.
Yeah.
But yes, you can still care for others, and you know, within the you know, the constraint of like the time that you have, and then, you know, and just do follow-ups like that took me a while to learn. Like when I was in like the system of like having like, you know, 10 minutes with the family, I'm like, oh God, like they bring up all this stuff and I don't have time, you know, to get into it. But I have evolved as a practitioner of like, listen, like you know, we have this amount of time for, you know, this appointment today. This is really important what you're up. I don't want to overlook it and not dive deeper. Like, let's fill up so that we can really take a look at this,
Yeah.
In detail. And now I know a little, about like the whole system. Like, we can talk about like that specific question at another time so that you get the care and that you need.
Yeah.
Because that's sometimes hard to do, when families are there and they want like, everything. And I have spent way much more time with my patients, than I did in a conventional setting. But you still, it's still, peeling of the onion. Sometimes it still does some time, and we are, of a culture where like you want, put it now, yeah. So that I have to keep reminding myself too.
Right.
Yeah.
Yeah. Well, and again, thank you for everything you do. I want to kind of switch over to our live questions for the people who are listening live now. Before we do, we've pinned your Amazon link for your book into the comment section. So anybody who wants to look at Lara's book, I highly recommend it. Click that link. Is there anything else last you want to make sure everybody knows? And is there any website or way people can contact you? Lara's in Central Connecticut. You're still in Glastonbury, right?
I am. Yep.
Okay. So she's in Central Connecticut, but any last info before we get to the questions, websites, way to contact you, anything at all?
Well, I mean, since you guys probably have my name, probably easiest way to remember, www.laraoneil.com is a little bit more of my author page than my business page, but there are links to my business page, which is Thrive Center for Health and Glass. But there's a contact page on laraoneil.com where you can reach out to me, and you can also access my book, and you can access the free walking meditation that comes with the sort of as a gift to me if you do order it today, because that does help a lot with that Amazon algorithm of getting it out there, getting visibility, really sort of continuing this momentum of change and rippling it out to people that are interested in hearing this message. So that really, I would really help. I'd really be grateful for any support around helping me spread the word.
Awesome. Yeah, everybody's got those algorithms, especially Amazon.
Everybody has those algorithms. There was already some hiccups. That's the way it goes. You have to go with the flow, right?
All we can do.
Yeah, exactly.
All right, let me get to some of our live questions. Some of them for you, some of them will be for me, and normally we get for autism stuff. Live shout out from Gada, and let's see, live shout out from Rodney. Rodney's on every week. Jasmine says, good morning, excited to listen to this. She asked, what supplement would you recommend for extremely off the charts camp kinase on the Cunningham panel? I'd love to ask your opinion as well on pandas and pans. From the way that I work with pandas and pans is there's a long-term infection inside the body. Think of long COVID, where people had symptoms forever because they just couldn't kick that virus out. So what I find is a good combination is antiviral therapies. And we've got some natural antiviral therapies, like on our Spectrum Awakening site, like our Viragon, and anti-inflammatories. So the anti-inflammatories we like to use are things like curcumin, and we've got a product, curcumis, and I'm a big fan of PEA, palmitoyl ethanolamide, and we've formulated that into a tasteless powder called Panda Bear. So it's this combo of antimicrobials and anti-inflammatories, but I don't even know, what do you do? Do you get into pandas and pans? I know it's pretty complicated.
Yeah, it is. And I do, there are some incredible practitioners in Connecticut that really dive deep with families on pan and pandas. So I call myself an expert because I do primary care, and it takes an enormous amount of time and energy. And I feel like to dive deep into that, you have to really sort of, specialize in it. But that being said, I do certainly have, like, my families that already are my patients, things come up and we're concerned about pandas, and I will do the workup and I will start the treatment and see how it goes. There's a range, obviously, of the severity, and sometimes I do have successful, with the treatment, and feel confident around that, but we'll reach out or refer if and when it's really needed. Like I don't, have the capacity to do IVIG and things like that, which has, helped some of my patients. But yes, I agree with that. First of all, you got to dig deep and to find out like maybe what that trigger is for that inflammation in the brain. It's often strep, but also COVID, and other things in mycoplasma. And even I feel like possibly stress, like, or at least when it has PANS or PANDAS, I see flares with emotional stress, and then mold, things like that. So figuring out what the talk, or maybe one, make it even more complex. There could be more than one thing that the child is dealing with that's sort of overloading them and causing that inflammation. So then, according to the results of what's going on in their body, then working on that sort of step 1, step 2, step 3 approach of first, like eliminating or treating that infection or that toxic source,
Yeah.
and then moving on to like reducing, with it too, at the same time, but like reducing the inflammation, and then just supporting the strength of their constitution and their health so that they can continue to, fight this. And so, yes, I'll use a lot of, I'll certainly use like long-term antibiotics if we need to, if it's strep, or whatever, mycoplasma, that's a tricky one. But, and then different, herbs are so powerful. I like Viricon, I like Immunoberry, I like it, it depends. And then the anti-inflammatories, like you mentioned, I love and also SBMs. I don't know if you work with, I'm sure you do, the pro-resolving mediated SBMs.
No.
You know what I'm talking about? Oh, okay. That one I find is really powerful. It's like a natural anti-inflammatory.
Right.
So, because a lot of these kids, sometimes you end up using prednisone, but I prefer not to. And the SBMs are sort of like a natural ibuprofen almost. Like I'm way more than that, but just for the sake of this conversation, I've seen a huge infection plus the SBMs and other anti-inflammatory.
Awesome.
Yeah, I've seen a huge improvement.
That's amazing.
But it's it's complicated. It's a lot, and then these kids, you get them better, and then they get sick again, or they go back to school and it flares, and so you sort of have to have like a treatment plan. The families can start it again, without always having to reach out. But yeah, so does that answer your question?
Yeah, no, it's perfect. It's a lot.
Yeah.
I have one of my friends from college has 2 kids, one with autism and a neurotypical with PANDAS. And
Oh,
she says, I love both my kids, but man, on a day-to-day stress, I like the autism more than the PANDAS because the day-to-day stress and behaviors are so
I
intense.
know, so intense. And then I tell you, sometimes there's some, I don't, like sometimes I wonder, are autistic children more prone, or like what? I just can't help but wonder about, because whatever, thousands of kids every day, get strep, and why is it that one? Like, what is that? Is there a genetic predisposition? Is it because there's lots of stress on their body that they can't handle? Like but I do see, like, I feel like there's sometimes like people are coming to me and their children are having a lot of behavior issues, sort of neurotypical or atypical concerns, and we're trying to tease out like, well, this is
Right.
panda. Like, yeah, there's like or is it both? Or there's a continuum. So I love that there's tons of research on this.
Yeah.
And I feel like we've gotten a little farther along with the mainstream, but I still get people coming to me, and because they're like, I went to my pediatrician or my doctor or whatever, because I was like worried that pandas, because they, were peeing on their clothes in the corner of the room, and are acting weird and, not eating, whatever. And the pediatrician looked at them and said, that is not a thing. Like, I'm like, really? in 2024. Like, no, I'm sorry. But it's gotten better there, you know, in the mainstream. But also because of their ego, because they don't know how to treat it, they just no, your kid's acting bad.
Yeah.
That is so sad and angering.
Yeah.
But anyway, but they end up, because these are, you know, mama bears, they not, you know, they end up keep looking. Thank goodness.
Yeah, that's what you got to do.
Yeah.
So, I normally don't take questions out of order, but somebody just posted a question, then they wanted more explanation on the SBN that you mentioned. And again, this isn't something I know about either, so I'd love to.
Okay, so wow, I'm like, now I'm on the spot. So my understanding, so the pro-resolving mediators, my understanding, it's actually comes, it's a property of fish oil, the anti-inflammatory property of fish oil, but it is super, you know, extracted and concentrated, because you'd have to take, I don't, you know, like 100 pills a day, whatever. So I mean, that's all it is. Makes I think it's called SPM, metagenic SPM.
Okay, so it's SPM, Sam, Peter, Mary.
Yes, exactly.
Okay.
Yeah.
All right. Yeah, I'm going to look into this. It obviously,
yeah, that
so anti-inflammatory.
Yeah, they're like the immunomodulator component of fish oil.
Okay.
Yeah.
All right.
So it's just concentrated, so you you know,
sure.
You don't have to do a gallon, which wouldn't be good for you.
Right.
And I'm sure there's practitioners that could explain it a little bit better than me. But that's it, you know, that's it in a nutshell.
That is very interesting. I'm going to look into that. Well, yeah. it's like glutamine. I'd rather take a glutamine powder than eat a whole head of cabbage.
Exactly. So. Or glutathione. I mean, all of the, yeah. Yeah.
All right. Let me keep going. Jeannie says, "Hi, Lara. Congrats on your best doc win from Natural Nutmeg."
Oh, thank you. Yes, I know me and Dr. Scarron have both been in that category for several years now, and it's yeah, it's such an honor. Thank you.
It is, and Diane's great, and I have to decide if I'm going to the gala, the award.
I unfortunately can't.
Yeah, we went last year. It was
I'm
fun.
sure it was.
Yeah. Khadija asks if you ever come to the UK. I personally am going to be lecturing at an autism conference in June next year. We're deciding if it's going to be in London or Bournemouth. But I don't know about you. Do you do any international touring and lecturing?
Not at this point. Maybe someday. See how what gets but no, I'm pretty busy with my practice here.
I just need excuses for vacations. That's all. So
good. Amazing. I'd love to come to your conference. It sounds cool. Keep me updated.
I will. Yeah, we're just making it happen. We're creating an autism conference with our distributor. So we have a distributor for our supplements throughout Europe called Mandy Mart, and they're a family who has a kid on the spectrum, and they just decided to create this distribution company to help other families 20 years ago. And so we're just making a conference. So
great. And this is like, you know, but for some reason I just wanted to mention, because it came in, I don't think I ever told you this. Your book, which I know you wrote quite a while ago, 100 Natural Ways for Kids. Yeah. I read that like years ago when I first heard about you, and like that I was in the conventional medicine, but trying to a little bit more holistically, and loved it. And I do reference that at the back of my book.
Well, thank you. That's great to know.
I have a list of resources for parents and healthcare providers. Like, hey, this is what I, think you would love to read. And yeah, your book is back there. I know a long time ago, and you've evolved a lot as a practitioner, more into all this incredible stuff that you're doing. But anyway, just wanted to mention that.
Well, I appreciate that. Yeah, I'm trying to look around if I don't have one on my desk here, but yeah, that was a while ago, and it was interesting. That was published with Rodale, and they removed so much stuff that I had there. So I'm working on my next one. So hopefully the next one will be full Monty. Just let it all out.
Yes. Cool.
All right, let's see. We've got this from Hala. I mentioned pandas to my pediatrician before after my son got strep 5 times and started stimming, and I was told it was a fake diagnosis. So
Mm,
now,
I'm sorry.
let,
Yeah, no, it's not a fake.
let me ask you this. Where I understand the term pandas is new in the medical world,
Yeah.
I find it extremely similar, if not the same, to Sydenham's chorea or St. Vitus dance, as it was called hundreds of years ago. Do pediatricians see correlations in these symptoms and just other diagnostic terms?
That's a good question. I don't know.
Okay.
I feel like it's like there's this happiness to just land if once you have a term or a diagnosis something and like if and like the child's or person's presentation fits that, then they're like, okay, it's
Right.
this and name. And then they're like, I'm so smart, I gave you this name. But you know
Seriously.
what I'm saying. But mm,
Yeah.
you know, okay, cool, like that start. But if I'm understanding your question correctly, I do feel like that over the past 100 years or whatever, that there are so many misdiagnoses. I mean, I think mostly these children have been diagnosed with a mental health disorder
Yeah.
when it's pans or pandas. And that's what just I can't, like, it's just so sad.
Yeah.
Um, but yeah, like what's the other criteria, what's the other presentations, what's it been called before, what's the treatment before, I'm not sure, like, to tell you the truth, I feel like I can't really remember where I was at my understanding of pans and pandas when I was in the conventional setting, but it wasn't very involved. I
Right.
was understanding it, so I didn't, now I'm in my integrated practice, so I'm not talking to mainstream doctors the way that I used to have an understanding on what they're doing
Okay.
this right now,
Right.
except for like what people say when they come to me. I mean, I have had families come and say, like, my pediatrician said that, like, yeah, they think that that's what it is, but they don't know how to treat it, so you need to seek help elsewhere. And like, that's amazing, that's
Love it.
huge. That's all.
Love that.
And I do that too. Like, I mean, there's not, like, come on. Like, yes.
Yeah.
Yeah.
Yeah. No, I love that's no ego.
And that,
So I love that.
yeah, I know, it's great.
Yeah. All right. All right. We got time for a few more questions. Um, let's see. Chrissy watches Chrissy's a regular. Bingo, you just nailed it. These things happen so much. I've learned conventional medicine doesn't want to fix and balance things. They don't want to help you balance chemical imbalances, genetic mutations. They treat people with blinders. For example, conventional medicine thinks it's acceptable on something, and natural medicine is like no level of that it's acceptable. It's very sad. I agree with you, Chrissy. Live shout out to T. Here's a story from Haifa. My twins got the Hep B vaccine the day of birth, as is standard of care. They were born premature, weighing only 4 pounds. I wish I knew what I know now. I put the doctor's advice over my own instinct because I was made to feel that I didn't listen, something bad would happen to them. And just like a correlation to what you mentioned about the flu shot, same doses for a 6-month-old as for a 60-year-old. We're giving these shots that aren't tested on 3 or 4 pound babies. So,
I know. I mean, whatever you feel about vaccines, the Hep B at birth, whatever they weigh, 4 to maybe 10 pounds or whatever.
yeah,
Um, it just doesn't make any sense. If you choose, if you can choose to do it later when they're at risk, but you know, I they're not going to be having sex or getting IV blood transfusions before they leave the hospital, or there's something really wrong with the hospital. um, so like, yeah, just you and like, and I forgot her name. I'm sorry. Who had that experience where they were really bullied into doing that, because and I speak into my book around. Parents are so vulnerable when they're in the hospital with their newborns. and parents are sleep deprived and hormonal, and you got somebody coming in and saying like your child will die if they don't do this.
Yeah.
Evil, if you ask me.
Yeah.
So I mean, you can't feel bad about what happened. My kids are much older. Well, I don't, I'm not, now I can't remember. They get it at birth probably because I was naive and I wish that I didn't do it then, but it's okay and they're okay. And, you have to move on and we all make mistakes and we hope that it's not on our children, but unfortunately that's reality. But we can spread the word.
Exactly. Exactly. And like you said, it's part of protocol, it's part of standard of care. And when you get into hospitals, it's, you're dealing with an owner that's there for the profit. And so every little thing on that list that I can get insurance reimbursement for, I'm going to try to get. And that means you pressure patients to do it. And it sucks. All right, let me see if I can dig out a couple other questions for us. Let's see. A lot of people agreeing with everything you're saying. I'm trying to dig in for a question here. Um, Chrissy again said, you guys nailed it. Listening and having compassion, which shouldn't be the rarity, and it shouldn't be a surprise. And that makes me sad as well. Um, all right. A lot of good comments here. I'm just kind of digging in to the questions. All right. Let me wrap up with this one. Jeannie says, my child's therapist believes she could be PDA. She does not and never worked for rewards. Any suggestions? I'm not sure PDA acronym right now. She has many challenging behaviors, including aggression, but with laughing out of nowhere. I'm not. Is anything coming up for you for PDA acronym?
I'm not sure what PDA is.
All right, we'll keep moving on. Sometimes the Facebook and the autocorrects it to something else.
Yeah.
Well, here's one for you. I want to get your opinion on this. So I'll end with Gary Angela's question. She says her son's been experiencing sensory issues for over 8 months, unable to wear clothes. What do you normally suggest for treatments or testing? And just to kind of add on, so many of our kids on the spectrum, huge hypersensory issues, and it's a lot. It's a lot to deal with, not just with clothes, but cutting your hair and cutting your nails and picky eating. Excuse me. So would love to kind of get your take on that.
Yeah. On that spectrum of sensory issues to autism and just how to approach it. This is a huge one because once again, you have to sort of dive in on all the details, of the situation and what's going on in the age, and their history and what they've tried. But I mean, OT, like we have some incredible occupational therapists here that work, in Connecticut, and I'm sure in other states, that specialty in these children with the special needs, and I see like huge improvement with OT. So that's kind of, a go-to for me. It's hard to answer because it's multi-layered to kind of where to begin and what to address. But I'd say, OT at the top of my head kind of makes a really big difference. Sometimes chiropractic care, it's helping balancing that. We're supporting their neuroregulation, balancing that dysregulation. But also, I mean, some kids are just really sensitive and we just, you just work with that. Yeah. Not necessarily a bad thing, but it's such a huge continuum. So maybe a digger deep, like an evaluation on what's exactly going on, so that it can be best supported. But I get like just the day to day how hard it is. Like if you're just trying to get your kid dressed and out to school, and they're upset about, what they want to wear, or it's on backwards and they won't go to school. Like I get that is a huge problem with kids, but for the the constraint of this conversation.
Yeah, I like to kind of give a metaphor story when I talk to people about sensory issues. Like,
Yeah.
if I was asleep in the middle of the night and I heard a window crash in my house, then my adrenaline, my cortisol would go on super alarm, and my senses would be superhuman. I would hear every little creak in the house. I would see things better. I would smell. My senses would be so heightened because I'm in that stress response.
Exactly. Yes. Thank you for putting that words better like that. That's what I was speaking into, is that balance, the parasympathetic, sympathetic. Something is off,
Yeah.
perhaps a
Yeah.
heightened response.
Yeah. And like you said, it's finding what in that child is creating that constant hyper stress response, whether it's involves cortisol, it involves adrenaline, it could involve chronic infections, which
Right.
can cause stress.
Right. Exactly. So many layers.
So many.
You know, anything causing inflammation in their body is going to add to it as
Yeah.
well.
Yeah, for sure. So this has been great, Laura. Our hour always goes super fast when we're recording these. So,
Yeah.
I want to thank you again for coming on. And again, any last comments to our families who are listening out there? Again, I know we have your book tagged here, and we'll have it tagged on Podcast World and such. But if you want to give a shout out to the name of your book, where people can get it, contacting you, anything you need.
Yeah. So rescuing ourselves. A story of love, healing, and resilience through integrative medicine. It is really, you know, a call to action, rescuing ourselves, rescuing all of us, healthcare providers, people, families, children, um, just, you know, spreading the word of the change that needs to happen and the change that is happening, and continuing that. And yes, anybody that would, you know, order today or tomorrow, I would greatly appreciate it. The paperback will be available on the 26th, on an ebook person. But doing the ebook order today helps a lot with that algorithm. And just like the, you know, the last words is, I just like, I don't know, I just have so much respect and honor, you know, for these patients that are, you know, if they're following you, I know that they are healthcare warriors and themselves and their children. And I just like, you know, just keep doing it. And you know, it's amazing, and keep asking for it, keep searching for it. Don't like trust your gut. If your doctor or pediatrician, whoever is telling you something and you know it's wrong, like stick with it, like walk out or just say no. Like Dr. Scowen spoke into, they are just people too. So you can say no, or you can leave, or you know, find a different practice if it's not working for you, or just find care. You know, if you need a pediatrician for super, you know, some things, but find a naturopath. You can find a holistic provider that can support you in the ways that you know is really best for your children. You can do it.
Right. That's right. Nobody else is going to take care of your kids but you.
Do
So,
it. Ourselves is like, yeah, we do it ourselves.
yeah, exactly. All right. Well, thank you again, Laura. I really appreciate you coming
Yeah.
on. And I hope everybody takes a look at your book and reaches out to you for anything that they need.
Yeah, thank you so much. So fun to talk to you.
Yeah, sounds good. All right. We'll see you later. Thanks, everybody, for tuning in.
Bye.